Emma Children's Hospital is based in Amsterdam, and we focus on the rather complex diseases. Every child doesn't want to be ill, but how can you ensure that during the period of stay in the hospital you have the best stay that you could possibly have?
What we try to achieve is connect the patient with the hospital and with the outside world. And by doing that, we create a whole range of functionalities around information, communication, entertainment, and also involving the patient into the various hospital processes. For Emma Children's Hospital, the content that's going to be there is going to be very much tailored to the children and therefore increasing the patient experience.
When the patient is not getting bored, they're not trying to get contact with the team to make the calls, because they have things to do. When you're having fun, when you're distracted to your illness, to your pain, I think then you recover faster.
We call it soma and psyche. You have like you're physically ill, but your mental state is just as important, especially in kids. If you become really ill at a certain age, you have a risk that your development is being disturbed.
It is very gratifying to see how technology really transforms the experience. Our portal works best on the Apple platform. Requirements differ from hospital to hospital, and that is one of our key strengths together with Jamf, to create this customized solution to be able to really adapt to the needs of individual hospitals.
We have really integrated our system together with the Jamf system. So in this case we are pre-installing a number of apps, but we also have the option to use a private app store, so that the hospital has its own selection of apps that patient can install if they desire. As a system we are directly connected to HL7, so we're really getting the information from the hospital information system, like who is going to be admitted, where are they admitted, are they transferred, are they discharged. We can really target information.
We are learning what type of patients want what type of information in their electronic patient record. So if we wouldn't be able to connect, then I think it's a loss. It's a loss for the patient. The solution, in combination with the technology, enables that type of information exchange. It doesn't matter how ill you are, you deserve to have the best care process and have the best chances in life. We want to ensure that life is continuing in the most normal manner as possible.